Welcome to the Planet Rocc podcast. Hopefully we're able to spark thought on something new or rekindle thought on a forgotten subject. How you doing, family, and thanks for listening in. We have Carrie Taylor on the line with us today. She is a myofascial release therapist, and I'm going to let her explain that. Carrie, how you doing?
I'm good, Ron. How are you?
Good. I cannot complain. Thank you so much for helping us out with this and helping people understand. So,
Of course.
I know what myofascial release is, and I know what it feels like. So
You've had Michelle work on you.
I know, right? So if you would explain to everyone what a myofascial release therapist does. Like how does it work? What happens with it? What is it?
So basically, myofascial release is a type of massage therapy. It's performed by massage therapists. It's performed by physical therapists, occupational therapists. Sometimes even chiropractors do a little bit of myofascial release. And included in that would be some joint mobilizations. Now, a chiropractor would do a high-velocity one-way thrust manipulation where you hear the crack, whereas a myofascial release therapist would hold a joint at its end range and do some stretching with the pressure. So it's a lot of trigger point work, joint mobilizations, working on the soft tissue of your body without oil or lotion. So you're generally wearing shorts and a T-shirt or a tank top and shorts if you're a woman. And we will do work on you where we hold a lot of pressure points. You'll feel the work even in the bones. And it even would speak to visceral or organ dysfunctions. So we can work on the organs in your abdomen if there's any kind of dysfunction going on there. The way you get trained to do this kind of work, in where I come from in Canada, Vancouver, British Columbia, we have a 3,500-hour training program, which is a 3.5-year program that is full-time. We write a master's thesis on a project that we choose, and we defend our thesis. Then we are covered by medical insurance in Canada, so obviously the training has to be quite extensive. I have my Bachelor of Science in Human Physiology as well from the University of British Columbia, whereas someone in New York State, for example, would have 1,000 hours, which is the highest required hours in this country, in the U.S., and, for example, Georgia would have 500 hours, depending on what school you went to. So depending on the level of training you've had, you might have had some exposure to myofascial release as a therapist, and you'll see that come through in some people's work. Or you might have, no exposure because your training program was a little shorter and you just learned how to do Swedish massage. When people think of massage therapy, they think of Swedish massage, where this is very, very different.
Yeah. Explain the Swedish massage. It's probably going to ring more true or ring more familiar with everybody.
Yeah. So Swedish massage, or what a lot of clients or patients would refer to as deep tissue massage, is wringing of the body, kneading the muscles and soft tissues of the body. Really, no joint mobilizations. Generally, there is some type of oil or lotion used, so that there's a glide over the skin.
Yeah.
It really impacts your cardiovascular system. There's a lot of movement of fluids in the body when you get a Swedish or a deep tissue massage. It's what people think of when they think of spa treatment.
Right, right.
Yeah, whereas myofascial release, generally you could be under a sheet, unclothed, or you could be wearing clothes. It depends on the therapist. And, that's kind of the difference between Swedish or deep tissue, as a lot of clients call it, and myofascial release. And by the way, myofascial release, if done correctly, is very deep in the tissue, so it feels very strong.
Yeah, that's a good explanation. Yeah, yeah, it does have a strong feeling. I have to go with you on that.
Yep.
Well, it gives everybody a good look at what it is you do and why and how you do it. So why would someone come in to have this done? What would be the
So basically, what happens when people end up coming to me? I've been in the field for 20 years as a registered massage therapist and licensed massage therapist. Registered as Canadian, licensed as the state. And then I also have a personal training background for over 30 years, and I'm a yoga teacher as well. And nutrition falls under that as well.
Yeah.
But the reason someone might come to me is they've kind of tried or exhausted every other option. They've tried massage, they've tried chiropractic, they've tried different types of manual therapies, such as chiro, PT, or OT, occupational or physical therapy, and they're not finding that they're getting anywhere. Perhaps they're just not getting enough time from their therapist, or the gliding action of a Swedish deep tissue massage is not allowing them to relax and really benefit from the treatment. They might need some work from someone like me, where if they have a structural alignment issue or a postural problem, or an organ problem, their abdomen, they have Crohn's disease, they've had a mastectomy and they've got scar tissue, Those kinds of things are what I address. So generally people come to me with something different, and certainly even healthy people come to me. I treat a lot of stunt people in the film industry who you can imagine have a lot of aches and pains. It's a very underserved market, unfortunately, because they need the work the most. But those are generally healthy people, and they just have a lot of injuries. So someone might come to me if they've exhausted other options and really want to kind of get free from pain. That's my goal, is free from pain, structural alignment, and optimal function.
Okay. Now explain to the average listener, like when you say structural alignment, like what do you mean there?
So basically, I mean getting to the most optimal posture that your body can get to. So we sit around a lot at computers, at our desks, and I always say this to my students: sitting is the devil, because it's so hard on your large intestine and your organs. They're getting compressed all day. You're sitting on your hip joints, which are also getting compressed all day. If you add a little bit of weight gain, which can happen when you're sitting in an office all day, that can also lead to issues. And then you're hunching forward, looking at your computer or holding a phone on your ear. Those things will lead to less than optimal structural alignment. So your body is not where you want it to be for optimal function and freedom from pain. And that means hunching forward, sitting all day, joints not moving.
Now, so this is something that can be done proactively and reactively, right?
Yes. So I clients will ask me, well, how often should I come? And I always say, well, that's the million-dollar question. Is it within your budget to see a therapist who's out of network, doesn't take insurance?
Right.
Some physical therapists do this work, and I've taught them, and they do take insurance. So that's an option. I'll refer people to a physical therapist or occupational therapist if financial means are not available to do this kind of work.
Right.
I recommend most people see me once a week, and at a minimum, once the problems are resolved, once a month, just for proactive, preventative care. Because I can keep your issues at bay if I see you often enough.
Right.
Obviously, if you're doing something that's causing you pain, I can't help you if I don't see you. So
right.
This is something that I would say you can move to monthly if time and money are an issue, but I recommend weekly.
Right. Until the issue dissipates, and at that point of maintenance of at least once a month.
Yeah, and I'll tell you, for example, I've had clients who've had mastectomies and were having swelling and pain and mastitis, inflammation. They would come to me twice a week for 2-3 weeks, and then once we resolved the issue completely, then they would scale back to once every 2 weeks, and then scale back to once every month. I've even got a client that I'm thinking of who is able to scale back to quarterly treatments to keep it at bay, and she's obviously very happy about that. So we can't go more than 6 months with her, or she'll start getting swelling and pain again from the scars in her breasts after having mastectomy.
Yeah. Got you. This is some outstanding work that you do. Now you did mention that you do yoga and you do personal training and nutrition, and you add that in. I was going to say the $1 million question is, how does all of that work together?
So basically, my goal is to get somebody structurally aligned, which means good posture as their body can do with their structural setup. So everybody's skeleton is different. Everybody's body's different. Everybody's height, weight, physical activity level, nutrition, those are all different. So within that, I'd like to get them to the most posturally sound place that I can, which means freedom from pain, better flexibility, better function, better sleep, all those things. When you're in pain, you can't sleep, and sleep is needed to correct and repair damage, right?
Right.
So one of the things I like to talk to people about is how is your nutrition plan? I don't really believe in a diet, so to speak. I competed in bodybuilding, and I think dieting can be really hard on people.
Yeah.
It's not something they can stick to for their life.
Yeah,
so
I
like
know, right?
The idea of a sound nutrition plan that's something that they can stick to for their lifelong goals, which is to be as healthy and have the best function in their body possible, the best digestion, being able to go to the bathroom is important.
Right.
I try to work within all of that with people. Part of that would be activity. So I would recommend, if they're going to the gym daily or working out or walking or doing some activity daily, I'm not as worried about doing personal training with them. However, if they're not working out, there are some things that need to happen. You need to look at your nutrition plan. You need to look at your hydration, enough water, provided your doctor hasn't told you to stay away from water. Sometimes they do for blood pressure reasons.
Mm-hmm.
And then I would want someone I'd work on their flexibility with them. Within a myofacial session or a training session,
Mm-hmm.
I always stretch my clients and
Mm-hmm.
show them how to do stretches. I also have DVDs that I sell that have a workout for 31 minutes, like a core workout
Okay.
approach, and then a 20-minute stretch. So
Mhm.
I recommend if they're willing to do it on their own, then they can go off and do that DVD on their own. And if they're not willing to do it and need an appointment, then they should come to me as much as they can to get training. It depends on their goals.
Mhm.
Flexibility is important. Cardiovascular health is important.
Mhm.
And then, of course, stress reduction, which I speak to with yoga and massage and training.
Right.
There should be some correct breathing. I work on breathing with people and how to have correct breathing. That could be a whole show for you in one fell swoop talking about breathing. And we can do yoga within our session, within our personal training session, or I can add yoga into the myofascial experience. For example, I'm seeing someone today for 3 hours who will do an hour of training and yoga, and then we'll do a 2-hour treatment where she's laying on the table and I do stretching and bone work, or what I call osseous work, joint
Gotcha.
mobilizations, myofascial release, whatever she needs. And she has rheumatoid arthritis, so this keeps her rheumatoid arthritis at bay.
Got you. Has she been dealing with that for a long time, or?
20 plus years, and she just found me, so she's pretty excited about how much better she's feeling. She'll come in to my place limping and walk out like she's on a cloud and feeling great. So she said, "I can't believe how much better I feel when I leave here."
Really? Well, that's a good thing. So how long? I guess the arthritis won't go completely away. So how often is her setup? Is she once a week, twice a week?
She tries to come once a week. If she can come more than that, she does. But right now we're kind of, with time and work and everything else, it seems like once a week is what we do, and minimum of 2 hours for her, because she likes to do a little bit of training and a little bit of treatment. And once she's on the table, she always says to me, "Can I stay another hour?"
Gotcha. Okay.
Don't stop.
Yeah, and especially if she's getting results that she's wanting, she's definitely sticking around.
Absolutely.
I can understand that 1,000,000%. Now you have the DVD out with the with the ab work and the stretching. Can that be found on your Taylor Techniques Inc. Website, or?
Yes, so TaylorTechniquesInc.com is my website, and it's a core stability total body workout. So it really is a total body workout with core in mind for all the exercises. It's got some different options for you. There's a beginner level, an intermediate level, and an advanced level, all shown at the same time. So there's me, I'm in the center, and then there's 2 other ladies who are in it as well. And we also incorporate some yoga stretches, like triangle, warrior poses, just for strengthening and stretching. Like it's important to have a strong muscle that's also flexible. So I incorporate a little bit of yoga into that. Okay, so then there's a 20-minute stretch included at the end of the video, where it's basically me on the ground, standing, showing you how to do a full body stretch. With or without a yoga strap. You could use a towel or a belt or something else if you don't feel like getting a yoga strap. But that's really, really important. I feel like this video has helped so many people recover from injuries and prevent injuries. I personally put the video together after having abdominal surgery, C-section, 2 of them, and then also having clients who were expressing that their disc herniation problems were getting better with the type of workout exercises I was doing with them.
Right.
And they asked me to put a workout DVD together, and they couldn't remember what I had told them to do in the gym, so I put this video together. I had a film crew, a client who was a film artist, put it together for me professionally, so it was great production.
Good. That's real good to hear. Now, family, I will tell y'all this. Like you can see her pictures, on there, and Carrie is definitely in shape. She's been in competitive bodybuilding. She definitely does what she says. She lives with what she talks. But the pictures,
I do.
The pictures look nice, but you have to see her in person to be able to drop your jaw at. You had 2 C-sections. Like, you can't be serious right now. Like,
Yeah.
it works. She's a walking example of what she's saying works, right?
Yep.
Now, Carrie, is there anything that's on your mind, or anything that you like to impress other than what we've already gone over, that you like to impress upon just John Q. average when they try to pick your mind about what's best for them, or what should they do, or how you can help them?
Yeah, I think more important than anything else is to get moving. So For example, most people work at a desk job or are sitting a lot during the day. My biggest recommendation to my clients is get the stretch workout DVD and do that on your own. You don't need to pay me to yell at you to do exercises. You can have a little bit of discipline.
Yeah.
And then basically the stretch part of my DVD is wonderful. You can do it every day. You could actually do the core workout every day as well. And the other big thing that I tell clients is get a standing desk. Standing desks are so wonderful. They save your back. They save your hips. They allow your organs to be in a normal position, and it really prevents you from slouching and hunching over and just being completely inactive, which most people develop digestive issues as well because of sitting all the time. The standing desk thing, most workplaces will pay for that,
right,
or at least contribute, and so it's not an expensive thing. You can get adjustable, non-expensive standing desks. Those things all help, and then get moving. Just do a workout, go for a walk, do something. Any activity, even on your lunch break, walking around the block can be helpful to get some fresh air, not just for your body, but for your mental state too. And then breathing and yoga and getting myofascial release are icing on the cake. Those are all things that if you don't invest in yourself, nobody else is going to. And I use the plane analogy, when they say the oxygen masks are going to drop down if we experience a drop in cabin pressure. If you don't take care of yourself first, you can't take care of anyone else.
Exactly.
This applies to people who are caregivers who will feel guilty about doing something for themselves, and then once they kind of get my hands on them, they realize that it's so important to take care of yourself because you're going to last longer.
There is a high prevalence in American society of that train of thought. So
yep.
I'm very glad you brought that up.
Yeah, it's this kind of feeling of I'm going to be the first one in at my desk and the last one to leave, and there's no honor in that. There's honor in taking care of yourself so that when you are at your desk, you can work optimally.
Yeah, exactly. And not even your job, your home life, everything that depends on you is saying to you subconsciously, please take care of yourself because we need you. We need you here working, and not only just here, but for your body and your mind and your spirit to be able to function at the best level that you can. I mean, everybody wants that for their kids, their significant others, their jobs, themselves.
Well, I talk about that in my yoga classes a lot. I say, practice with kindness for your body. Live with kindness for your body because this body has to last longer than it ever has. We're living longer, and we don't want to be crippled at the end of our lives and stuck in a wheelchair if we can help it. And basically, you need to move it or you're going to lose it.
Yeah.
And the other piece is that you need to challenge your mind because your mind, 79% of Alzheimer's could be prevented if you did crosswords or remembered a yoga sequence or something that challenges your mind every day. You need to stimulate yourself. Your brain is an organ, too, that needs stimulation. And I think people forget that, if you don't practice what you preach, you can't really help your children learn either. And that's why I really try to practice what I preach just because I believe in that. And also, if I'm going to talk about doing workouts and getting treatments and being in shape, I go to the gym every day. I get treatment myself on my own body every week. I stretch every day. I drink a ton of water.
Right.
I eat as healthy as possible. Nobody's perfect, but I eat as healthy as I possibly can. Lots of fruits and vegetables, a little bit of meat here and there, but not crazy. And I try not to overdo anything.
Right.
And, I get as much sleep as I possibly can too. It's important to rest and rejuvenate.
That is 1,000,000% correct. I knew I was asking the right person to be on one of these podcasts because everything you're talking about is what we're trying to impress upon people. And I think you hit the nail on the head with stimulate your mind. That's a control center, of your body, and we can control that mind and learn more about it. But of course, you need all of these things to work out, in harmony at whatever level of health it is that's defined by you. But you definitely exemplify that, and I appreciate you 1,000,000 times for doing this. Thank you. Thank you so much.
It's all about balance.
It is. It really is. I believe that wholeheartedly, and and that there are examples all over the place, that proves it to us. We just have to watch it. There was a
well, you have to look for a mentor or someone who can help you get to the next level. And sometimes we need a coach. It could be a coach, a talk therapist if you're experiencing some difficulties mentally. It could be a personal trainer if you're experiencing some difficulties with your workouts.
Right.
It could be a nutritionist if you need some help with your nutrition plan, et cetera, et cetera. There are people out there who do this for a living for a reason because it helps people. Exactly.
You're 5,000,000% correct. I mean, which is why I asked you to come do this. After we met and and got to talk, I was like, oh my goodness, yes, the family needs to hear her.
Yes. Well, I appreciate being on the show, too.
Oh, trust me, my pleasure. Well, what we'll do is hopefully get another podcast with you and maybe focus in a little bit more on the yoga side, because I know that
Absolutely.
a lot of people will hear yoga but not really understand, where does yoga come from? How does it know? How does it really work? Like, what are the different types? You know, you hear these different things and don't have any understanding of it. But you are a person that are very busy. You're heading to New York tomorrow.
Yep, tomorrow I'm going to see some patients, and a lot of times I'll teach while I'm up there. I'm a continuing ed provider for PTs, OTs, and LMTs, and RMTs, and all those kinds of people.
Any other therapists you can come up with?
Yeah, exactly. But I actually would love to speak more about yoga. I feel like the biggest piece of yoga for most people is accessibility. And as a teacher, I have new people in my classes all the time, and I want them to feel like they're getting an education as well as an experience.
Exactly.
That they understand what the steps and the stages and we call them the 6 stages and 7 guidelines. But
Okay.
there are 6 basic stages in a vinyasa class and 7 guidelines around how we teach it. And then there are different styles of yoga: Ashtanga, Vinyasa, Bikram, Kundalini, there Hatha, different types of Yin yoga, Yang yoga. So there are all different types. You hear all these things, and people get overwhelmed, and they think they can't do anything, and they get analysis paralysis and don't go. And I would tell you that it's so important just to go, because most yoga instructors are wonderful people, and they do it because they want people to enjoy it and be accessible. And so I feel like all you have to do is show up, and something great's going to happen.
Let's show up and learn and
Yep.
breathe.
And have an open mind.
Yeah, you have to. You have to.
Yep.
You know.
But I'd
Well,
be happy to come back and talk about yoga for sure.
that we definitely need that. So now, for them to reach you, your website is www.taylortechniquesinc.com.
Taylor Techniques with an S, Inc.com.
And there's a phone number. I'm going to have all of it listed, but for everyone who's not watching, the phone number is 917-701-1030. And there's also a Twitter handle at Carrie L as in Larry Taylor. All right, and the Facebook page is Taylor Techniques.
My email as well is on the website, but I can give it to you now. Taylor Techniques at Hotmail.
Oh, at Hotmail. Okay, yeah. So all of that. If you're listening in your car or on your phone right now, I realize you can't see it, but when you get a moment, just come back into the website and pull it up, and you'll be able to see all of this information that'll come in and out on the visuals. All right.
Great.
So Carrie, thank you a lot. I look forward to talking to you again.
My pleasure, and I look forward to seeing you in person again for more book photographs.
Oh yeah, that's right. Exactly. And I gotta finally make a yoga class. So I have to do the same thing, fam. I gotta go in, and trust me, I go in and I get tortured every time, but it helps.
Well, I look forward to hosting you at my yoga class maybe next Sunday.
I'll be in Birmingham, but we'll get it together.
We'll figure it out.
Yeah, we'll figure it out. Well, thank you, Carrie.
You are so welcome, and I look forward to talking again with you.
That concludes the Planet Rocc podcast topic for today. Should you have questions or comments, please either send an email to comments@planetrocc.us, click the Ask the Trainer button, or give us a call at 877-776-2290. Thank you.